The adductor muscle group is often forgotten, ignored, not talked about, and I think that's mainly because people assume the adductor muscle group does adduction and that's it. But there's actually a lot of other stuff that the adductor muscle group does. It's functionally important, and I'm going to tell you why. Reason number one is that it performs flexion of the hip and extension of the hip. It just depends on which position you're in. So if you're in a lot of flexion, your adductor muscles are going to do extension of the hip. But if you're in a lot of extension, your adductor muscles are going to do flexion of the hip. Why is this important? It's important because our adductor muscles don't just do adduction. The interesting thing is that line between when do they perform flexion, when do they perform extension, is about 40 to 70 degrees of hip flexion. And the further you get away from that, the more powerful of a hip flexor or hip extensor the adductor muscle group is. This is also why people who have adductor muscle strains have pain with a lot more than just movements that include adduction. Sprinting, running, changing direction, deadlifts, squats are all going to hurt because these are all movements that include hip adductors as a component to create that movement. Reason number two, it's that the hip adductors actually perform internal rotation of the hip. And you might be wondering, how on earth does that work? Because the adductors insert on the posterior surface of the femur. So the thing to remember, though, is that the femur bone is curved. And because it's curved like this, it puts these insertions anterior to the mechanical axis. And anything anterior to the mechanical axis, you pull on it, you're going to cause internal rotation. So just with this short video, I hope that we've demonstrated that the adductors should not be viewed just as a group that does adduction. They're a complex, multifactorial group that does multiple things that have a big place in the lower extremity, functionally for patients as well as for people who are just training in the gym. And if you found this interesting, please give this a like. If you have any questions, please put them down below. For more information like this, I hope to be putting stuff out like this every week. So thank you all, and have a nice day.